Dr. Hana'a Badran. She is an internationally trained pediatrician from Jordan with special interest in clinical research, promoting mental health and health equity. She received her MD full scholarship from Jordan University of Science and Technology, then did 1 year of internship at Jordan Ministry of Health. Dr. Hana'a completed her pediatric residency training from Jordan Hospital and became Pediatric Arab Board certified in 2010. She worked in King Hussein Cancer Center and was responsible for teaching and supervising medical students and junior residents, was involved in patient and family education, participating in updating policies and guidelines at the Department of Pediatrics. Dr. Hana'a has more than 3 years of experience in pain management and palliative care in pediatric cancer patients, and more than 7 years in providing telehealth for pediatric patients. In Toronto, she is a cohort 11 graduate of the IT Bridging program at Ryerson University. Currently, Dr. Hana'a is involved in different clinical research studies and projects focusing on preventing and management of diabetes, mental health during COVID-19 pandemic, and maternal and child health handbook promotion in Canada. The floor is yours, Dr. Hana'a. Now you can proceed. Thank you.
Thank you, Mikila. Thank you, everyone, and thank you, Dr. Shafi, for giving me this opportunity to present today. I'll share my screen. Yeah. So today I'll topic about how you can live healthy with diabetes, lifestyle modification for patients with diabetes, and challenges during COVID-19. The content of my presentation will be a short introduction and the importance of lifestyle modification, what are the key elements in the lifestyle management, and what are the self-care behaviors, and what changes have been done to managing type 2 diabetes during the COVID-19 pandemic. So first of all, a short introduction about diabetes. We all know that it's a problem in insulin production or in the use of insulin. So there is no insulin enough, or there's no appropriate use of insulin to use the energy, the glucose as an energy source. The impact, why it's important to talk about lifestyle modification, because we all know the impact of having diabetes. It increases the risk of strokes, heart attacks, kidney disease, and all traumatic, non-traumatic leg amputation. And for me, let me know if we give me the permission to share my personal experience. I had the chance to live the full spectrum of having diabetes. I lost my father because of diabetes complication, because he didn't comply with the diet modification, lifestyle changes. He was of the generation that if I had one day to live, I will live eating whatever I want. And on the other side, I had my husband who was diagnosed with diabetes, but within 6 months, he managed to control his hemoglobin A1C from above 12 to less than 7 and to reduce his weight. And now he's off medication and just controlling his hemoglobin A1C. So this topic is of a great passion to me and is of a great importance, that I want to convey the message of how it's important to have a lifestyle modification to prevent and delay diabetic complication. You have diabetes, so this is the point. You cannot ignore, you cannot deny, but you are expected to live a normal life, have your normal activity, enjoy your life with your kids, go to work, and you can do it. And the first thing that you can to achieve that is believe that you can do it. The problem in Canada that there is so much denial or neglect of the diet change that can affect people to have diabetes or to develop other chronic diseases. There is 1 in 3 kids and 2 in 3 adults having obesity and are overweight. And there is 1 in 5 adults who live with chronic disease. And some will have heart disease, strokes, and any other chronic disease that mainly due to not being compliant with the diet. And to manage your diabetes, you are not supposed to be a doctor. You just want to follow simple guidelines and you can manage it. The elements in lifestyle management, they are simple. They are called Life Simple 7. Diet and the importance of diet, and think what to eat, when to eat it, and how to eat it. The nutritional facts in each food you buy is not put there for nothing. Please read these facts. Know how much you can eat. Think of your choices. Instead of drinking a bottle of juice, eat an apple. So these things will help you. Manage your weight. It's important not only for reducing the risk of diabetes, it will improve your overall or fitness and wellness. It will improve your mood and your emotion. Having exercise, regular and maintained exercise. You have to be sustained on a regular schedule, not only for a short duration to see the effects. At least you have to be compliant for 6 months to see the effects. And start gradual. If you can do it for half an hour, start 10 minutes, then increase gradually. Stop smoking. And it's a very important point. Try to quit smoking because it's a very dangerous, and it will be a very dangerous addition that you are a diabetic and smoker at the same time. Control your blood pressure, and this will decrease your risk of having strokes and heart diseases. Control your cholesterol and blood lipids, and always monitor your readings, your blood sugar, your blood pressure, and your cholesterol. And the most important thing are self-care behaviors. So they are behaviors that we can do it. They are easily to be done, but they need first to be consistent and to be determined that I will do it. And there is always support for you to help you in doing that. First, by healthy eating. Think how to eat, when to eat, and what to eat. And think of healthy substitute for feeding. If you are like chocolate, eat chocolate. But instead of eating a whole big bar, try to buy the mini bars. It will help you. It will stop your chocolate craving, and at the same time, it will give you less amount of sugar. If you like to go out and eat outside, take your meal with you. It will be much better than buying from outside. So manage and plan in advance. Be active. So the recommendation is to have at least 30 minutes of aerobic activity 5 days a week. If you can't start it like that, start gradually and increase until you find yourself comfortable with the physical activity. If you want weight loss, not only physical activity, you can do more than that. And always look for something to motivate you. If you feel motivated while walking your dog, then do it. If you feel motivated while having someone else with you, do it. Just find yourself a motivation and keep going. Monitoring. It's very always important to monitor your blood glucose level. We don't want to over treat glucose levels. And also monitor your blood pressure, your cholesterol levels, and keep a record of these records for you. Taking your medication, whether they are insulin, oral antidiabetic medications, other medications for cardiovascular, for cholesterol control. Always know your medication. Take them on time. If you have problem in memorizing the time of your medication, put an alarm on your phone. Put them in a box that have the day and time. They will help you in taking this on time. And even ask for help if someone else at home can support you and can make a reminder for you to have your medication. Problem solving. So whatever we do, we know that we will have some problem in management of our diabetes. It's the nature of diabetes. But Don't think about that in the beginning. Try to solve each problem one at a time, and have a documentation of, if I face this problem, how did I act? So later on, if you face it again, you will memorize how did you manage, and ask for help, ask for support. There are always lots of supporters for you. Reduce your risk. There are other risk factors that may increase because you are diabetic. Reduce your cardiovascular risk, you reduce your stroke risks, and now reduce your COVID-19 risks. Having your shots on time will help you to manage your general condition. Healthy coping. So diabetes is a lifelong disease. It will not go away by day and night. You have to know how to live with it. Don't fight it, so just live with it. And try to cope. It's a lifelong disease and you can manage that. So for the diabetic patient, always know your A, B, C, D, E, and triple S. Know your hemoglobin A1C, you know how to control your blood pressure, and what's the aim for your blood pressure. The aim for your blood pressure as a diabetic is different than patient without diabetes. We aim for 130 below and diastolic below 80. And this is an doctor office readings. At home, your aim is 125 over 75. You know your cholesterol aim. Know your drugs, when to take it, and what other drugs can help you in management your risk factors. Do your exercise and eat a healthy food. Do have always a motivation for self-management and have your support, and identify your goals and how you can achieve your goals. Screen for complication, your heart, your feet, kidneys, and eyes, and stop smoking. And now the challenge with the COVID-19, how can I manage my diabetes during this time, during the lockdown, during the limitation on doctor's visits and doctor's clinic? So there are recommendations what to continue. There is still continue for in-person visits if there is a high risk diabetic patient, if the hemoglobin A1C is not controlled, is above 8. And there is always self-management should continue all over the journey of diabetes. But for the COVID-19 specific, there is now shifting to the virtual care for more telehealth and telemedicine when it is possible. And when I say it's possible, when the hemoglobin A1C is below 8 and there is no acute symptoms or acute threatening conditions. Delay, sometimes we can delay the follow-ups if everything under control, if the hemoglobin A1C is below 8 and there is no risk factors, you can delay your eye follow-up from once yearly to 3 yearly. You even can defer your ECG being done, not as frequent as before. All of that to help you stay safe, stay home as long as you can. And the changes has been done to know your A, B, C, D, triple S, to know your A, B, C, D, E, and 8S. So the changes is screening cardiac, and what's the now how can you defer screening if everything is under control? Screening your feet, you can use a photo to send it to your doctor if you suspect anything, as Dr. Akam said. And screening kidney, and it should be done regularly, but you can defer the timing if everything under control. Screening retinopathy and how you can be changes to every 3 years. Stop smoking, especially that people will now use smoking to reduce their stress because of the lockdown or because of the COVID-19. So importance of education and supporting these people to quit smoking. Consideration of self-management and how it's very important now. And there is always applications, phone applications, virtual cares, and telemedicine that you can use, and the importance of mental health for management of your diabetes during the pandemics. The importance now of shots and immunization, whether it's flu shots, pneumonia vaccination, and now the COVID-19 vaccination. And always think of your safety. Being at home as much as you can. If it's not necessary to go to the clinic, please manage your diabetes at home. It does not need a physician. It does just need a support, and you will be expert to manage your diabetes. And always, if there is a necessity to go to the clinic, try to limit the time and try to have a talk over the phone with the doctor and answer as many short questions as you can over the phone before going to the clinic. This will limit the time spending out. And know that you are not alone. You are the center of the care, but you are not alone. There is a team, and all of your team will help you in any step of your journey. Always keep your records in your diabetes passport. It's available in Service Ontario. It's available in many languages. This passport will contain not only your glucose levels, it will have your team names, contact numbers, your medication time. So anytime you have an appointment, please carry this passport with you. And as a take-home message, you can live healthy with diabetes. Just follow these simple but important advices, and it really works. It's not the end. It's only diabetes. It will not take your hope, your faith, your spirit, your determination and love. And there are always support for you. The government of Canada is providing a lot of support, especially during the time of COVID-19. And it's only a roller coaster, so it's your choice to scream or enjoy the ride. Thank you.